Hi, I'm Dr. Mary Peavy.
And I'm Matt Coward.
Dr. Coward, I'd love to learn a bit more about the special tests that you can do for a semen analysis beyond a typical semen analysis that a man might have, or things you might be able to offer for testing.
Sure, so first thing is everyone needs one, and if it's abnormal, we need a second one. So that's the basics. So a lot of our patients are gonna end up with 2 semen analyses initially.
Okay.
We'll get a strict morphology with that as well. And then beyond that, there's a lot of things that we can do, but the most common one I would say we order is a DNA fragmentation test.
Okay. Is that testing that's done on a blood sample or semen sample, or how does that work?
Good question. So that's another semen study. So as part of a DNA fragmentation test, we actually get a semen analysis, and then we measure the percentage of sperm that are abnormal based on fragmented DNA. And it's normal to have up to about 20% of your sperm have an abnormal DNA. And when we start seeing higher DNA fragmentation, like 30 and 40%, we start seeing failures of reproduction, failures of IUI and IVF.
That's really interesting. Are there options for couples if the male partner is found to have higher DNA fragmentation, or what might the pathway be after that?
Sure, so there's a lot of things we can do, but the first thing is to treat the underlying problem. And so one of the things that we do, which is really unique in the region, is offering an office-based male fertility evaluation. So for example, if he has a varicocele, we'd want to treat that before anything else that you would do for DNA fragmentation. If he's uses tobacco or has other chemical exposures, other sort of occupational risk, we might talk about those lifestyle measures and decreasing use of alcohol and caffeine and marijuana. These are all things that contribute to high DNA fragmentation. Beyond that, when we start talking about if we've done everything that we can to improve it and it is what it is, now we have to start talking about how do we get the good sperm coupled with the egg.
Optimize.
Right, and so to optimize the sperm sample, there's a couple of things we can do. One would be Zymote. And so Zymote is a device that we use here at Atlantic Reproduction, which takes the sperm sample and it essentially runs it through a little maze, but the sperm swim across, and when they get to the other end, you have the better sperm. So these are the higher motility and lower DNA fragmented sperm. And then we use those preferentially for assisted reproduction.
So it might help in the sperm selection process to pick the better sperm of that sample if you have underlying DNA fragmentation. Traditionally,
the embryologist just looks for the best sperm as far as shape and motility, but this is another measure that helps improve DNA fragmentation. Then there's another procedure that we do for high DNA fragmentation, and that's testicular sperm extraction.
Okay.
That's more utilized when patients have previously failed IVF or failed IUI. And we do it sometimes when they even have sperm in the ejaculate, because those ejaculated sperm samples have the high DNA fragmentation, and how that occurs is through the transit. There's a 74-day transit from production to ejaculation, which is where the sperm are exposed to all the different body elements and heat and toxins and everything from their lifestyle. Sometimes we're not able to identify what it is, but we can go into the testicle and behind the blood testis barrier and get the fresh baby-born sperm that were just made, and those have much lower DNA fragmentation. And so if we use testicular sperm with IVF, we see a lot higher IVF success, better fertilization, better blastulation rates, better quality embryos, and ultimately what everyone wants, which is a higher pregnancy and live birth rate.
So that would involve a procedure here in the office, correct, to extract those sperm from the testicle itself, right?
Right. Most of the time that's done awake. We do offer it with anesthesia, but it's an office-based procedure. It takes about 45 minutes, and we make a little tiny incision, and it's just a little tiny biopsy, so local anesthetic only. And then that sperm is then frozen in our lab. It can be used fresh, and so that's another common discussion we'll get in with our patients, fresh versus frozen.
Right.
But we'll do it either way, and there's advantages and disadvantages to each.
Wonderful, and then that sperm would be combined for use during the IVF cycle with the patient's partner, correct?
Exactly, so once the eggs come out during the IVF cycle, we either we thaw the frozen sperm, or we take it out fresh and use it having never been frozen, and then actually inject the sperm into the egg in a process called ICSI, intracytoplasmic sperm injection, and that's how we find sperm with lower DNA fragmentation rates.
It's wonderful that we're able to offer that to couples and patients who might be running into this barrier.
And it's one of the most unique aspects of Atlantic Reproductive and why I love being here.